Hello everyone, I am Dr. Vibhor Borkar. I am a pediatric gastroenterologist and hepatologist practicing in Mumbai area. Today we are going to discuss a very important topic, that is food allergies and food intolerance. Knowing the difference between these two entities can make a lot of difference in your child's eating practices and health. Let's dive into this discussion. Now, most of the time we get confused between what is food allergy and what is food intolerance. Okay, now let's understand. Food allergies means whenever we are taking any food and it goes inside the body, our immune system senses that it is something dangerous entity and tries to create a response to it, that is called an immune response, and as a result that immune response affect our body at multiple places. It can affect skin, it can affect respiratory system, or it can affect the intestinal system. When it affects these one, or it can affect one of the all the three, or it can affect all these three systems, that is called as a food allergy. And against this, food intolerance is a particular portion of the food when it goes into the intestine, or intestine is not able to digest it. Then what happens? The bacteria, it gets for the bacteria to eat it, and bacteria produces a lot of gas, bloating, and the child has some problem. That is food intolerance. So this is a basic difference between food allergies and food intolerance. Now let's see what are the symptoms. Whenever there is a food allergy, your child can get respiratory symptoms, like he can have the symptoms like asthma, can get a heavy breathing. Sometimes they can get a swelling around the lips, they can get hives on the skin. In the intestine, they can get vomiting, nausea, diarrhea, and rarely blood in the stool also, like a milk allergy in small babies. In food intolerance, generally also there can be overlap. Why they are confusing? Because there can be an overlap between the symptoms of food allergy and food intolerance. In food intolerance, you can get symptoms like nausea, vomiting, bloating, tummy distension, and farting. But most important is life-threatening conditions. Life-threatening conditions like anaphylaxis. What happens in anaphylaxis? Suddenly there is a lot of cytokine release inside the body because of this allergen, and similarly there can be drop in blood pressure, there can be difficulty in the breathing, and sometimes it can be life-threatening also. So if there are allergies, you have to be careful about it. So let's see what are the common food stuff for which you can get allergies. One is egg and milk, seafoods like sea fish, shellfish, then peanuts, tree nuts, wheat. So these are very common food stuff. So you have to find out which food is actually causing the allergy. Let's discuss how to diagnose it. First thing, when you are getting this problem like food allergies, multiple systems are involved. So best way is to consult your child specialist or to consult to the pediatric specialist of that system. Suppose you have a skin allergy issue, you consult a skin specialist. You have a respiratory issues, you have to consult a pulmonologist, pediatric pulmonologist. You have a GI issues, you have to consult a pediatric gastroenterologist, because the diagnosis and the management might differ. Now how to diagnose? So whenever the symptom correlation is very important, whether it is intolerance or food allergies. So for food allergies, there are certain tests, right? There can be an IgE mediated blood test. Other test can be a skin prick test, whether a small amount of that allergen is injected inside the skin and doctors observe for the reaction. Having said that, none of these tests are foolproof. So anytime the clinical test like giving a for certain food and observing the changes in the clinical symptoms can be done. Now for food intolerance, again very important is the clinical observation and the diary notes kept by the mother and what happens to the symptoms. Along with that, certain foodstuffs like lactose intolerance, we have a bread analyzer test. So we can give a lactose test, and we have certain machines which can say how the carbon dioxide has increased or not, and that tells you okay, there is a lactose intolerance is there or not. So these are the different types of tests available to look for food allergies and food intolerance. Now management is simple But it is very important to note the particular aspects of this management, because in allergy sometimes there can be an anaphylaxis. Anaphylaxis means there is a life-threatening reaction to the allergen. So we have to be very careful. So whenever we have come to know about a certain food allergen, you have to stop that allergen, and that has to be stopped completely. So there is no bargain when you are dealing with the allergy. You have to stop completely. If you get even the slightest amount, immune system is very smart to pick up that, and there will be the symptom. So there is no bargain here. Vis-a-vis in food intolerance, you have to find out a level where your body can tolerate that food stuff. And once you till that level you can tolerate, otherwise you can have alternatives. So for food allergy you have to be very careful. You have to avoid the food stuff. So very important is when you are eating something from outside, so where you don't know what ingredients are put. Similarly, when you are getting a food product which is industry made, have a habit of reading food labels and look for the allergen. Sometimes the warning of the allergen may not be all inclusive, and the food items to which your kid is allergic, it may not be mentioned. So be very careful about the reading the food labels. Also inform the child's school teachers about the food allergies. Many times kids share the tiffin at the school, or sometimes at many of the functions like the birthdays, certain foodstuffs are distributed. So be careful about that. For food intolerance, you have to either decrease the amount of food you are getting. For example, for a milk, you can just decrease the milk intake, or you can replace it with the lactose-free milk or other alternatives like soya milk, almond milk, coconut milk. So you can find an alternative as well. So now let's see what happens once you have stopped this food allergen. Now many of the food allergies are self-limited. As children grow, their immune system matures and they learn that okay, this particular food stuff is not harmful and your body can accept it. So most important food where the children outgrow the allergy is milk and soya bean. These allergies they outgrow as they grow up. But however, certain allergies can be very difficult to outgrow, like peanut allergies. This can be very severe and the allergy remains for a very prolonged duration. And now what happens to food intolerance? Like lactose intolerance is very common, and most of the lactose intolerance remains lifelong. But you can have a certain amount of milk which your intestine can tolerate. You have to just find that. About the other food intolerance, again, sometimes it can be temporary. For example, you got some food poisoning, GI infection, all the balance of the bacterial intestine has gone haywire. At that time, for a certain duration, your body may not able to tolerate certain foods. That is a self-limited food intolerance and can remain up to 8 to 12 weeks. But certain food items can be intolerant for quite a long duration. It has to be individualized. There cannot be a set rule for everything. So dear friends, it was about the food allergies and intolerance, and we have learned that knowing allergies is very important. And so most important is don't self-diagnose yourself. Take help of a doctors which are around you. We will try to help your kid to come out of this situation. If you have any queries, any questions, try to reach me and my team. Thank you for patiently listening to me. Please don't forget to like, share and subscribe my channel. Thank you.